My name is Dr. Michelle Wise, and I am an obstetrician in Auckland and a researcher at the University of Auckland Medical School. We have been hearing so many questions from pregnant women who are considering getting the vaccine that they just don't have enough information and they still have questions that need answering. So I thought, who better to ask than my obstetrician friends from around New Zealand and pose to them the common questions that were being asked by women who are planning pregnancy, who are pregnant, or are breastfeeding.
Pregnant women, you're a priority for vaccination.
In my view, the vaccination for wahine hapu is an absolute must.
So if you're pregnant, thinking of becoming pregnant or breastfeeding, I strongly recommend vaccination against COVID-19 for your health and the health of your baby.
We are recommending that pregnant women at any stage of the pregnancy get the vaccine.
It improves maternal safety and therefore improves pregnancy outcomes.
Get the jab and get New Zealand safe.
Kia ora koutou. Ko Taranaki toko mana, ko Angatahua toko awa, ko Taranaki Tuturu toko iwi, ko ngā mahanga a tairi toko hapu, ko Li Duncan ahau. So I work as an obstetrician and gynaecologist at Hawke's Bay.
Kia ora everyone, my name's Emma Jackson. So I'm an obstetrician and gynaecologist working in Christchurch.
Kia ora, kia rana, misampula binaka, whakalawhalahi atu tā lofa lava, and very warm Pacific greetings to you all. My name is Dr. Karapuni Ukesene Ngafa. I am an ONG specialist that works at Middlemore Hospital.
My name is Isabel. I'm one of the obstetricians at Waikato Hospital.
Sean Pocock, I'm an obstetrician and I live and work in Gisborne.
Kia ora, my name's Sarah Corbett. I'm an obstetrician in South Auckland.
I'm Dr. Nari Anderson, obstetrician and gynaecologist and senior lecturer at the University of Auckland.
My name's Katie Groom and I'm a maternal fetal medicine specialist and obstetrician at National Women's in Auckland, and I'm a researcher at the Liggins Institute.
I've been talking to many women recently in the clinic, and the main question is always, what's the safest or what's the best thing that I can do for me or the baby? And not many times we can be so certain, but this time I know what is the best thing that you can do for your baby, for yourself, and for your whānau, and it's to get the COVID vaccine. We know it's safe for pregnant women, and it will avoid an infection that could affect you and your baby and the whole community.
The experience that friends and colleagues of mine from the States tell me is that pregnant women can get quite sick with COVID, sicker than your average person, and the pregnancies can have complications. And we know that vaccination is the best way of decreasing these risks.
I've spent a lot of time in the last 2 weeks talking to obstetricians from the UK and the USA, and they're all saying that Delta is really, the pregnant women are getting a lot sicker with it. They're saying like up to a third of women who get Delta in pregnancy ending up sick enough to be in hospital, 1 in 10 in ICU. And that means that we often need to deliver their babies early, and all the sort of stuff that goes with being really unwell when you're giving birth. It's really had quite an impact. We've got cases at the moment and it's a lot worse than it has been.
Pregnant women who have a higher risk of severe illness from COVID-19 during pregnancy, and I have witnessed this myself. I've been looking after very, very sick pregnant women who end up being admitted into intensive care units.
Over 200,000 pregnant women across America and the UK have had the vaccine, and they have had reports if they had occurred of any adverse effects, and there have been none. So in a really large cohort of pregnant women, we know that we haven't had any adverse effects. But what we know so far is that pregnant women may get some side effects from the vaccine, but that will be just like everybody else. So those things like arm pain, chills, fevers, maybe headaches, but we don't expect that it will cause any harm for their pregnancies.
Tens of thousands of pregnant women have been vaccinated internationally, and it's been proven to be safe in all trimesters of pregnancy and in breastfeeding mothers. Vaccinated mothers are much less likely to get COVID-19 infection, and if they do, are much less likely to have a severe infection. Babies born to vaccinated mothers are healthy and have the added bonus of having natural antibodies against COVID-19 in their blood that have been passed on from the mother. This is the best protection that babies can have against COVID infection.
You can have this at any stage during your pregnancy. There is no evidence of increased risk of miscarriage or any abnormalities to the baby as a consequence of having the vaccines.
Looking at thousands of women that have had the COVID vaccine and showing no increase in miscarriages in those women, and also reassuringly lots of women having had the vaccination and showing no effect on future fertility and being able to subsequently conceive after having the vaccine. So we'd certainly encourage women, if they haven't had the vaccine yet and they're in the first trimester, to go ahead and have it. There's no reason to delay having the vaccine. So another question we've been asked by women is, what do I do about the other vaccine? Which one should I do, in what order, and how close together can I have them? But the recommendation is that women get the COVID vaccine probably first, followed by secondarily the whooping cough vaccine, and then the influenza vaccine after that.
I think it's important for everyone to know that the vaccine is not a live vaccine. So there's no live virus in there. People won't get COVID from having the vaccine. The ones that are not live vaccines, they're just getting your body to produce a response that would work for that virus. And those are the ones that we definitely recommend women should be having in pregnancy. And actually, we've got a lot of experience of women having those sort of vaccines during pregnancy over many, many years, and they are a safe thing to do. And that would be the same in us recommending the whooping cough vaccine or the influenza vaccine in pregnancy.
I tried to put it into an analogy of the Earth being in an earthquake kind of situation. Drop, cover, hold on. It's actually safer to have the COVID-19 vaccination than to be a wahine hapu without the vaccination. Please drop into your closest vaccination centre and get a vaccination. Cover up when you're out in the community, obviously mask wearing. Cover also to me means cover off the information you're getting. If you're pregnant or you've got whānau members that are pregnant, please, please, please get the correct information. The hold on is to hold on to those values that are very prominent in Te Ao Māori, the ones of manaakitanga, whanangatanga, whanaungatanga, and kaitiaki-tanga. So looking after those around you and looking at the long term and doing everything you can to care, especially for our wahine hapu and our older generation as well, like our kaumātua as well.
All us healthcare professionals are encouraged to be vaccinated so that we could do our job and we could look after you, your whānau, and your families. And we would encourage you to do the same. It would be lovely if you vaccinate yourself to protect us as well, so that we can continue to carry on with our job. The mRNA, Pfizer, and Moderna rapidly break down in the body and does not appear to pass into the breast milk. Please be vaccinated to protect yourselves, your whānau, your family, your community, and it also helps protect us too, so that we can carry on and do our job. Whakawelahi whanono mai, awhitai lava, and nisambula vinaka, kia monuena.
So if you have actually made it to watching the end of this video and want to book an appointment for a vaccine, you can call the COVID vaccination helpline on 0800 282926, or you can go online to bookmyvaccine.co.nz.